Norditropin is a bioidentical HGH brand that Novo Nordisk releases. Norditropin is created using recombinant DNA technology and is molecularly the same as the endogenous HGH that the body creates on its own. Norditropin is one of the many forms of recombinant human growth hormone available from the Conscious Evolution Institute. The treatment is available in lyophilized form and mechanical pens that efficiently and effectively deliver the medication to the patient. For children, norditropin is prescribed as a treatment for childhood HGH deficiency and idiopathic short stature. The medication is prescribed for adult human growth hormone deficiency and HIV-related muscle atrophy for adults. One of the most common reasons for human growth hormone deficiency later in life is somatopause or age-related HGH deficiency. As men and women grow older, they lose the ability to effectively produce natural human growth hormone. Many patients become symptomatic over time, leading to several symptoms of HGH deficiency, including norditropin therapy can mitigate the effects of HGH decline in patients suffering from human growth hormone deficiency, helping them live happier, healthier, and more productive lives. If you are interested in norditropin HGH, call the Conscious Evolution Institute today, and we can make an appointment with one of our representatives to get the preliminary diagnostic testing you need to discover if you need norditropin. When norditropin is used by patients that display a genuine clinical need, norditropin is incredibly safe and has a low risk of side effects. Side effects, when experienced, can be treated quickly and effectively. There are some side effects that you may experience while using norditropin. These include irritation around the administration site, fluid retention, which leads to the swelling of the hands and feet, hyperglycemia, joint stiffness, muscle pain, headaches. In most cases, these symptoms simply mean that you need to have your dosage adjusted and receive too high of a norditropin dose. Adjusting the norditropin dosage reduces the impact of these symptoms in most cases. There are some serious but rare side effects associated with norditropin injections. These include vomiting, nausea, vision issues, and headaches. These symptoms are generally caused by high intracranial pressure and can be relieved by reducing the dose or suspending treatment. Of course, no medication is perfect for everyone, and some people should not use norditropin. The following adult patients should not use norditropin: adult patients allergic to the ingredients of norditropin, adult patients with active tumors or cancer, adult patients currently experiencing a serious illness involving stomach or heart surgery, adult patients with severe respiratory issues, pregnant or nursing women. Patients that have diabetes or have a history of cancer may be eligible for norditropin HGH injections but should discuss their medical history honestly with their doctors. Human growth hormone can impact insulin levels, so it's essential to monitor insulin levels closely if you are a patient with diabetes, and you may need to adjust your insulin dosage to compensate. The cost of norditropin will vary dependent upon the needs of the patient. The price of norditropin will depend upon the dosage prescribed. The physicians at the Conscious Evolution Institute will only allow patients to buy norditropin that displays a clear medical need. The Conscious Evolution Institute offers competitive prices for norditropin and affordable payment plans to help patients get the treatment they deserve. Norditropin is delivered using a method known as subcutaneous injection. In this method of treatment, a small, thin needle delivers the medication into the deepest layers of the skin, where it is slowly absorbed into the bloodstream over the course of the day. Norditropin can be purchased in vials and delivered via syringe, but norditropin also offers devices that make the norditropin injection process simpler and more accessible. Novo Nordisk provides two Norditropin pens used to deliver the medication, the Norditropin Flex Pro and the Norditropin NordiFlex. The Flex Pro pen is the most popular form of the Norditropin pen. These pens come pre-loaded and pre-filled, so there is no muss and fuss when getting ready to perform an injection. Flex Pro pens come in three variations depending on the dose prescribed, with max doses of 2, 4, and 8 milligrams respectively. A dial on the side of the device allows the patient to adjust the medication to the perfect dose easily. The NordiFlex pen is similar to the Flex Pro pen, using a similar design philosophy. The NordiFlex pen delivers a maximum dose of 3 milligrams. Norditropin pens use a particular needle known as Novo Fine needles. Although these needles are smaller than similar needles, they can still deliver the medication effectively. Novo Fine needles are 30 gauge, meaning they are just over 1/3 of a millimeter in thickness. These needles are 8 millimeters in length. On the other hand, vaccination needles are 15 to 31 millimeters long and are more than half a millimeter thick. Because of the small size of the needles and the short length, most patients have absolutely no issue with the injections. 9 out of 10 patients say that Novo Fine needles are essentially pain-free. Norditropin pens should be stored in the refrigerator before they are used for the first time, but after their first use, they can be kept at room temperature and do not need refrigeration. Norditropin is suitable for 3 weeks after the first use. Always adhere strictly to expiration dates and never use Norditropin 3 weeks after its first use. The Conscious Evolution Institute is your source for quality hormone replacement therapy all across the United States. If you are interested in Norditropin or any other form of bioidentical HGH, we can find out if you qualify for treatment. Just click the link below in the description of this video to contact us via our contact form or call our telephone number.